Good morning, everyone, and especially good morning and thank you to the team up here at Jacoby Hospital. You have done an amazing job. I was here last week when there was an unfortunate shooting here at the facilities, and your response after dealing with such a traumatic experience, I just want to thank you, and we take our hats off to what you're doing. And I agree with you about the issues around expanding mental health beds. I stood with Neisner often about this issue. If we need help from the state, I'm going to ride to Albany with you as we advocate on increasing access to psychiatric beds. So we're here today with some great news, and although we have continued the success under the previous administration, we want to show why our system of government works, is because it's about continuation. And I want to take my hat off to the de Blasio's administration for putting in place some very tough decisions around mandates and around how do we ensure that we can make our city a safe place. And I just want to commend them for what they have done. And I'm going to call the mayor later today and just tell him that we were able to build on what he put in place already. But before I get into COVID, I just want to give a quick update on the storm. We saw our first major storm. We had a storm around the first week of being in office, but this major storm hit our city. And I want to take my hat off to DSNY, DOT, Parks, OEM, FDNY, and EMS, and our transit employees. This city kept moving. They responded rapidly. We were prepared. We mobilized immediately, and it made a big difference to allow our nurses, our other professionals to use the transportation system to get in to do the job they need. We must be in alignment to make sure that all of these entities work together to move our city and keep our city moving forward. But let's be clear, the snow may have stopped, but the work did not. There's so much more we have to do, and we are doing just that. And we're really reaching out to our snow laborers. We want them to help and register. Snow laborers should report to their local sanitation garage today, Monday and Tuesday. And we have a website for them to register with, and just come out and just continue to assist us in moving our city forward. So we're here for a reason at Jacoby Hospital. For 2 years, they have been on the front line. I remember being here advocating with the nurses out in the front yard, talking about how staffing, PPEs, and other resources were needed. We stood with them and continue to do so. And we saw their heroism, as I stated last Tuesday, when a person discharged a gun inside one of the locations in this hospital. There were patients in the hospital location, as well as a child was there that could have been susceptible to this violence. And we know that hospitals oftentimes see people who are not only at the end of their rope on medical issues, but also on psychiatric issues. And that is why building out the infrastructure and support is crucial. We won't be able to just police our way out of the crises that we're facing. It's the combination that's needed, and I understand that. And I want to thank my team here. We've assembled together an amazing team of those who are committed to the health and well-being of the city. Dr. Chakshi, Health Department team as well, and my good friend Dr. Katz that's here, and Dr. Fassan, who's going to be in charge of the Commissioner of the Department of Health and Mental Hygiene, and his team. We're 1 month into 2022, and we started strong. We have done an amazing job, and we gave New York something that I heard often on the campaign trail. We gave them clarity. Clarity on how we're going to deal with the violence. Our people are back at work. Our schools are open. The number of times I hear from parents that are just saying thank you. We're not waking up in the morning trying to figure out what we're going to do with our children. You were clear that schools will remain open, and we did just that. The safest place for students and young people is in a school building, and we stood on that, and we're going to continue to stand firm on that. And New Yorkers are winning. We have a lot to do, but let's be clear, we're winning, and the key indicators are showing that we are beating back Omicron variant, and we're doing it in a successful way. Since our last briefing, all indicators are saying we're headed in the right direction. A rapid decline in cases. They remain high, but clearly they are declining. Hospitalizations are down. COVID deaths are down. And that is because of the hard work of everyday New Yorkers that are doing the right thing around vaccinations and booster shots. And we want to continue our vaccination effort to make sure that we continue to have our city up and running in the right direction. And let's be clear, we're not just putting out that message, we are leading the country. We are leading the country. And we have to really say thank you to New Yorkers and our hospital administrators and staff. We have the highest vaccination rate in the nation. In the nation. And that says a lot. 75% of New York City residents are fully vaccinated. An amazing milestone we reached this week. New York City is leading the way ahead of the national average by over 11%. 85% of New York City adults are fully vaccinated, and 50% of children 5 and older. Those numbers are impressive. We got the message out. And by the way, Doctor, I love your commercial. You know, you convinced a couple of people to get vaccinated by that well-thought-out commercial and the team that you guys have put together. We're doing it right by using social media, credible messengers, data, and one-on-one communication. And so when you think about the success of what we're doing, it shows that 16.3 million doses were administered in New York City. 16.3 million. A challenging task when you think about New Yorkers and how New Yorkers want to do things their own way, but they realized that the data was clear. This was the right way to do it. We also had over 2.7 million booster shots, and we're going to keep going. We're going to keep the information out. And the message is clear. Get vaccinated and stay up to date with your booster. This pandemic is still here. It's claiming lives. In January alone, New York City has lost more than 2,300 of our neighbors, our friends, and our families, and it is impactful. It's a long way from the days when we were on the ground, and those of you here in the hospital watching the countless number of patients that we lost, people dropping off their loved ones to the hospital, never to see them again. We know how impactful it was, and many of you lost your colleagues. It was traumatizing to go through what you went through, and I was there with you and saw the impact of COVID, and we're not going backwards. So let's get vaccinated, let's get our booster shots, and let's do the smart things, social distancing, washing our hands, wearing our face masks, so that we can keep our city safe. People who have their boosters are far more protected than those who are not, and people who are vaccinated. The CDC's study that was just released is a clear indicator that we were in the right direction and doing the right thing. And we are bringing more help to the front door. Speaking with Dr. Choksi over the week and talking about this, I'm just really proud of how we are just being proactive around dealing with this violence. Already, our at-home vaccination have helped thousands of New Yorkers get their shots, because if you are vulnerable based on pre-existing conditions or comorbidity, we don't want you to have to move out in the public to get your vaccines. We want to do the at-home delivery, and we have been doing that, and I commend the team for making this happen. Strategically, it's a real challenge, but we have been pulling it off. The city will also offer at-home delivery of COVID antiviral pills to eligible New Yorkers who need them, and we're going to do it with the magic New York word. We're going to do it for free. For free. Delivering the antiviral pills to you at home if you're an eligible New Yorker, and it's for free. We want to make sure that no one with COVID has to move throughout the city, especially for those who have immune compromise or our elderly. We want to bring it to you, and we want you to take advantage of this. This is a great deal and a great program we put together. And it's proven to keep people out of the hospital, particularly those who are at risk or seriously ill. It's a win-win for us. New York is one of the only places in the nation where we are doing this free delivery. One of the only places in the nation. And so here at Jacoby Hospital in the Bronx, this community was hit so hard with COVID. The numbers really spoke for themselves, and it was imperative that we all urge all New Yorkers, particularly black and brown communities, and those who are vulnerable about this same day at-home delivery, same day at-home delivery once you receive the prescription. And there's also one-time IV treatment that's also available. So there's a host of things that we have put in place for those to prevent COVID, and if you have COVID, to prevent you from having a life-threatening illness. And you could call 212-COVID-19 to get further information. We're going to get the help, but most importantly, we're going to get stuff done in the city to fight back COVID and fight back some of the other challenges we are facing. I've said this over and over again, and will continue to say, this is an administration that's about getting stuff done. Not getting caught up in bureaucracy, not coming up with reasons why we can't fail. If it's removing snow, removing crime, removing the challenges of COVID, this is an administration that will get stuff done. That's where we are, and that's what New York is expected of me, and that's what I'm going to do in the process. So now I want to bring up Dr. Chakshi, and then Dr. Katz, and then we're open to some Q&A. So again, thank you, Jacoby, for what you have done. Let's continue to do what you know best how to do. Let's keep people safe, healthy, and give them the support they need. Doctor?
Thank you so much, Mr. Mayor. And let me start where you left off, which is because we're here at Jacoby today, for me to sincerely thank all of my fellow healthcare workers who have sacrificed so much of their time and, in some cases, their well-being to keep our neighbors and our city healthy throughout these last 2 years. It's because of your continued sacrifice that we're able to be here today. The Omicron wave resurfaced the collective trauma that we felt in spring of 2020. But we are in a different place now. Thanks to the safe and effective vaccines, many of us are protected against the worst of COVID-19. At the same time, we must continue to recognize that there are still New Yorkers who are at high risk for the worst outcomes of the virus. And we all have a role in protecting them and preventing needless suffering and death. As the mayor said, 75% of all New Yorkers are fully vaccinated. It is truly a remarkable milestone. If you had asked me a year ago if we'd get to this level, I would have said, it's my greatest hope, but it would be extremely tough. Now, here we are, including 85% of adults fully vaccinated, and millions having taken the booster to stay up to date. We do have more work to do, especially in getting our youngest vaccinated. To date, only 36% of children aged 5 to 12 are fully vaccinated. So I urge all parents to extend the protection of vaccination to your kids and to consult with your pediatrician on any lingering questions. 76% of adolescents 13 to 17 are fully vaccinated, which shows it can be done. We should derive inspiration from this hospital's namesake, Dr. Abraham Jacoby, known as the father of American pediatrics, because of his unwavering dedication to the welfare of children. 2 years into this pandemic, we've learned a lot about the links between exposure, infection, and disease. Masks, testing, ventilation, and vaccines weaken the link between exposure and infection. Staying up to date with vaccination and new and better treatments weaken the link between infection and disease. Taken together, all of these tools help us defang the virus, keeping our loved ones out of the hospital and saving lives. Oral antiviral pills like Paxlovid and Molnupiravir, taken for 5 days, help stop the virus from reproducing, which reduces the amount of virus in the body and prevents symptoms from getting worse. Similarly, one-time intravenous monoclonal antibody treatments like sotrovimab offer protection against severe outcomes. Getting treated early is crucial, so if you have symptoms or were recently exposed, get tested immediately. Then, and this is particularly for those who are at higher risk, like older adults or those with weakened immune systems, speak to your doctor about treatment options. Any New Yorker can also call 212-COVID-19 to get linked to a provider. If you are prescribed either of the oral antiviral pills, we will deliver them to your home via a partnership between the health department and Alto Pharmacy. This is usually a same-day delivery so that you can begin your treatment as soon as possible. These treatments are most effective when they are started soon after diagnosis. I'm proud that New York City is one of the few places around the world offering same-day delivery of these vital therapies. We've already heard from New Yorkers about how meaningful this is to them, particularly because of the worry and the uncertainty that accompanies every COVID-19 diagnosis. One patient who was undergoing treatment for cancer was grateful that the medicine came to her door. She wasn't feeling well and didn't have anyone she could ask to go to the pharmacy for her. Another patient in Brooklyn told us they had an amazing experience being served by Alto. Their prescription was delivered within hours of their doctor writing it. They conveyed that everyone in our country should have access to such wonderful care and attention. We've already served over 3,000 patients, and as with everything else we've done during COVID response, equity is our guiding light. We are working with community health centers and local providers, particularly those serving communities of color, to ensure they know how to access these life-saving treatments. That's part of the reason the mayor felt strongly about bringing you this news from here in the Bronx, which has certainly felt the brunt of this pandemic. Finally, let me say one more thing. You'll hear a lot about living with COVID in the weeks ahead, but living with COVID cannot mean ignoring that too many continue to die from this virus. With these new treatments and, of course, our life-saving vaccines, we now have the tools to mitigate the worst of COVID-19. Let's put them to good use. Thank you so much, sir.
Thank you, Dave. And Mr. Mayor, I'm just so proud of the people who work at Jacoby. It's really been hell. It's been hell for 2 years. Various flavors of hell, but we've lived through hell in its various ways. The horrible times of March 2020 when we saw so many people die, the second cycle, the third cycle of Delta, and the Delta then going into Omicron, where so many of us ourselves got sick. Nurses were taking care of 8 patients, 12 patients, 16 patients, doing the very best they could under incredibly difficult circumstances. We have a phenomenal leadership team here, our CEO, Chris, our Chief Medical Officer, our Chief Nursing Officer, our Chief Administrative Officer, and just an amazing group of doctors and nurses who really care about the patients, who every day come here. In the snowstorm yesterday, people traveled long distances and they got to work, right? Many people got to stay home, right? We heard your warning, sir. If you don't have to go to work, don't go to work. But the people here, they came to work, right? They knew that they were needed. They knew that other people's lives depended on them. They came to work, and I'm incredibly proud. I want to say, sir, we so much appreciated that you came on the day of the shooting, and I want to say to the nurses and the staff of the ED, we see you. We understand that you take care of people who have been harmed by shootings, by stabbings, but when there are actually gunshots in our own ED, it's a completely different thing. It's a trauma to us, to our other patients. We so much appreciate, sir, your commitment to getting the guns off the street, to employing young people, to making sure that people have productive jobs and that we have a kind of social equity that doesn't lead to this cycle that you've talked about of violence. We're going to do everything we can to figure out how we make our hospital, our emergency department, safe places to work so that we can still take care of people who may be harmed by violence, but that the workers themselves do not feel that they may be the next victim from that gun. That's very important. I want to thank my board members for coming and for always being of great support to health and hospitals. Thank you.
Thank you so much, Dr. Katz. And I just want to reiterate, next week, and my team that's here, we're going to reach out one day next week. I'm looking at some of the signs. Next week, I'll do a Zoom with you, and let's identify the list of things that you think are important. It's imperative to speak to people on the ground, so expect my team to speak with one of you, and let's find out exactly those lists. There are things I could do within my span of control. But, you know, Dr. Vassan reminds me all the time. He says, Eric, we also need help from the federal and the state. And so I need you to help me get the help that we need. I'm going to do my job. That's my promise to you. But some of the things we need help from our feds and from the state. Let's mobilize together. But we will communicate next week to hear the list of things that you stated that we can do, that we can implement right away, short term, midterm, and long term, because we're going to do one thing together. We're going to get stuff done. That's my promise. We're going to open the floor to any questions to the doctors or the wish he was a doctor, Eric Adams, you know. So we're opening it up. I hope it wasn't lost on you that Dr. Chosky and I got the same memo. His gray suit looks better, though, you know. So we'll open the floor to any questions.
Two questions. With regards to boosters, is there a percentage of people who've gotten the boosters? Last I saw it was pretty low, so what is being done to push that up? And secondly, with the numbers declining, is there any way of accounting for the at-home tests? Are you trying to do anything with giving people a way to report themselves if they test at home? And do you have any concern that those, you know, that it's artificially low because people are testing at home?
Sure, thank you so much. I'll start, and then perhaps Dr. Long wants to address the testing part of it as well. For the booster doses, so we do capture the additional doses administered in New York City on our website thus far. It's about 2.7 million doses that have been administered. With respect to the percentages, that is data that we're analyzing and compiling. We want to be able to track it, not just in terms of who is getting the booster dose, what proportion, but particularly for the subgroups where booster doses are most important. For example, those who are 65 years and older, how many of them have received a booster dose? That is data that we're working on compiling and will be put on our website along with everything else once that data is sufficiently valid. With respect to the testing question, I'll just start briefly and then invite Dr. Long. What I can tell you is that we made a concerted push, and the mayor was very strong in making sure that at-home testing was available to all New Yorkers. This is so important to ensure that people know if they are positive as soon as possible in order to isolate and break chains of transmission. But for another reason that's related to why we're here this morning, which is once you know you're positive, and particularly if you're higher risk, you can access the treatment options that we're talking about. So that's why we have made these at-home tests widely available. There have been millions that have been distributed across New York City. This has raised questions about the data with respect to our cases and surveillance. What I'll say is that I can reassure everyone that we are still doing a very high number of PCR and laboratory-reported antigen tests as well. And so that allows us to keep a bead on the trajectory of the pandemic with validity based on the numbers that we're reporting out every day. I'll see if Dr. Long wants to add anything.
Okay, and thank you for the question. It's something that we hear about a lot. I want to start off by saying I am a strong supporter of the at-home tests. Your Test and Trace Corps across New York City has distributed more than 8 million of the at-home tests so far. And it's for the simple reason that there should be no wrong door to getting tested. Any way that meets you where you are in order to get you tested is the right way to get tested. In our schools, we've distributed millions of the at-home tests. We've identified tens of thousands of people in our schools rapidly, helping them to isolate right away and helping to drive down our percent positivity so that our schools can remain one of the safest places for young people and our staff to be anywhere in the country. Also, it can meet you where you are in your own personal circumstance. My dad's 83. He recently came for the holidays. When he came to my place from the airport. When he came in through the door, no hugs. Here's your Binax. Here's my Binax. You're over there, I'm over here. And I also required him to have the booster. We did them at home. His was negative, mine was negative. We had a great hug. He'd never met my daughter before. And we had an amazing holiday together. But that met me where I was. It wasn't feasible for him to go on the way from the airport to my place to get the PCR to wait in another room in my place. Wasn't gonna work for us. So moving forward, I think with the at-home tests, there's two very important things that we want to do for New York City. The first is anytime somebody has a positive test at home, we want to make sure New Yorkers know what that means. The CDC has put out the guidance that is the science. It is what you should do. But it's our job now, as the health departments, as health and hospitals, to communicate that clearly to people. And that's what we're going to continue to be doing through Test and Trace. And you're going to see that moving forward so that people can know what they need to do if they have a positive test to keep their families safe, which we know is everybody's highest priority. The second thing is, now that we're announcing today that we can do same-day delivery of these life-saving medications, which I, by the way, as a doctor right here in the Bronx, I'm a primary care doctor at Morrisania, 4 years now. I'm there every single Friday. I've been aching for the day where I can give my patients a pill to save their lives. I can't tell you how emotional I get thinking about how far we've come with COVID. Now, if you have a positive at-home test, we want all New Yorkers to know, if I'm your doctor, I'll prescribe this life-saving pill to you. It'll be delivered to you. But if you don't have a doctor like me, call 212-COVID-19, and there's no barriers to having access to this new medication to everybody across New York City, however you've been tested. And if the home test is a way for you to be tested so that you know what to do and so that you can have your life saved by the pill, that's the way to get tested. Thank you.
Thank you. Dr. Long is on our morning briefings. And he always has this energy. This guy is always on, We're going to do press. I'm going to come and talk to you one-on-one. We're going to do press right now. I'll be over to see you. Go ahead.
In the same vein as Aaron's question, I see other cities and other states doing massive PR campaigns saying, report your at-home tests. It helps keep us, abreast of what's happening in the city and in the state. Why does New York City not feel it's necessary to report at-home tests and have that apparatus available?
I'm sorry, report the at-home test when someone takes it, for them to report their...
Local health authorities.
Okay, any of you guys want to talk about that?
So what you're getting at there is an important question, which is how do we understand where transmission is happening across New York City every day? One of the statistics we look at for that is the percent positivity by neighborhood and across the city. Percent positivity is based on the PCR test. So when we're, for example, our school surveillance program is PCR test based with a random sample, and across our city, we're doing more than 100,000 PCR and antigen tests every day now. So we have an excellent line of sight, actually the strongest line of sight we've ever had into where cases are across New York City. So we believe that our surveillance program, which is constituted by doing 100,000 tests that are recorded every day, plus our Test and Trace Corps with the information we get there, plus the fact that we're genotyping 15% of samples every single day and week that goes by, we have a very strong surveillance system. And for the home tests, we just want to make it an easy way for you to know if you're positive. Because again, if you have a home test, or if I with my dad had a home test, it would have fundamentally changed what we did. He's 83, he's at high risk, and my kids aren't vaccinated, they're 1 and 2. So we want people with the home test just to be able to know exactly what it means for them, but our line of sight remains very strong in New York City.
Difficult at all to set up something like an online portal just for folks to say, you know, this is where I live, this is how I tested? Would that be helpful at all, or is that too much information?
Well, right now, even with rapid tests, our percent positivity is based on the PCR. So if we're looking to gather more information, if we need to, if we don't do 100,000 tests a day or something like that in the future, we always maintain the capability to do that. And one of the things that we're looking to do now is to build out more things like a portal to connect you to resources. So if you have a positive test, again, you know where to go, you know what it means for you. But we've delivered millions of meals to people, and that's the way that they stay at home. So we're thinking about this more about meeting people where they are because our surveillance system is so strong. We want to have our efforts really be to help New Yorkers to get through this as Omicron cases are coming down into the next phase.
And that's a great question that you ask. But all researchers would tell you it's the sampling of populations. And what we're doing with the volume of tests that we're taking, that's giving us a sampling of the population. When you do polling, you don't call every New Yorker, you call a sampling of the population that can give you a definition of where we need to deploy resources, and that's what we're doing.
Mayor, at some point, hoping that the numbers continue to keep going down, at some point, when do you consider perhaps dropping a vaccine mandate for restaurants and bars? Is that on your radar at all?
Based on the doctors that are here, they're going to make that determination. I've stated this from the beginning. I'm going to go based on advice of my medical experts. You put good people in office so that they can give you great information. And so when they make that determination, we do morning calls every morning. They would tell me, Eric, here's where we must turn it up. Here's what we can modify. Here's what we're going to change. I'm going to follow their guidance.
If I could just follow up on that topic, you know, it's not purely a health equation here. It's also an economic equation. And we see New York City's economic recovery is lagging behind a lot of other cities. Restaurant reservations are lagging behind other cities. How much is that going to factor into that decision?
A lot. You know, I have this balance that I must do. I must take my medical advice with the economic advice. Just as I'm sitting down with my doctors and medical professionals, I'm sitting down with my economists, those who are looking at how do we get our city up and operating, because you're right, we have to do a balance, because if we don't get the city up and operating, that brings about some negative impacts as well. So that's why I'm very delicate about, do we just openly do mandates? Do we openly do, you know, giving restrictions on our businesses? I must get my restaurants up and operating. We need to make sure we get tourism back in the city, a major economic driver. So you're dead on. We have to have that right balance. It can't be just one way or the other, and that's what we're looking at. Every day we're looking at that.
Oh, off topic?
It's Lisa.
Mr. Mayor, you started out the week with your gun safety plan talking about the need for bail reform. You wanted to have judges have discretion, and also about the Manhattan DA. We heard that heartbreaking comments by the widow of Detective Jason Rivera on Friday at the funeral, where she called him out specifically and about the need for bail reform in order to make the people of the city as well as the police officers safe. Do you have any new thoughts as a result of that emotional plea that she basically made on Friday?
Well, you know, sometimes people focus on one aspect of a well thought out approach to making our city safe from gun violence and some of the other violence that we have witnessed. It was my job to state, as a former law enforcement person and as a former lawmaker, it was my job to do an analysis of what are the rivers that feed the sea of violence. One of the rivers is what is happening in Albany. And this is not a fight between Eric and Albany. Those are friends. It is about using the expertise to say, how do we tweak laws to get what we're looking for? Let me tell you what happened, Lisa. We are creating laws on the city, state, and federal level. The goal, as I said, the prerequisite to prosperity is public safety and justice. We focused on the justice aspect. We didn't look at the safety aspect. We need people that are part of reform to also talk about what's the safety aspect. You can't have a safe city if you do justice only or safety only. You can't have heavy-handed policing, and you can't have heavy-handed laws that are going to be draconian, but you have to deal with safety. That's real. A 19-year-old girl being shot in McDonald's, a 20-year-old baby wearing a police uniform, that's someone's child. And that's what that mother shared, and that's what the wife shared. We have to make sure this city is safe, and we could do it with justice, and that's the conversation I want to have, and we could do it together.
Follow up on that, in terms of the nurses and what happened here in Jacoby and their safety working as they deliver health care to people who are most urgently in need of it. Just as someone that's dedicated your life to public safety, what would you say would be some measures that you would like to look at to make them feel safe?
Yes, and the day of the shooting, I didn't broadcast it. I traveled here that day, and I spoke with the staff because I understand the trauma of being in an environment where there's gun violence. And we have our ideas, but I am a strong believer, let's speak to the people on the ground. That's why next week, the week coming, or this week, I should say, I'm going to speak directly to them and say, give me some of your ideas. You are in this hospital, and you know exactly what you believe that's needed. And those that are within my span of control and that we agree on, I'm going to have the police commissioner on the phone. I'm going to have Dr. Katz on the phone. I'm going to have the hospital police on the phone. And we're going to, on the Zoom, and we're going to say, okay, what are your ideas on the ground? And we'll match it with what we believe we should do, and we'll come with the right attitude of protecting people. Safe work environments mean everyone, and you cannot do your job if you feel unsafe.
Mayor, I have a question about the community here.
I'm sorry?
Question about this community you're in right now?
Yes.
Okay. You're in Community Board 11 right now.
Yes.
There are 3 single men's homeless shelters proposed for this community, which would be 540 single adult men, which could be drug users, people with psychiatric issues, level 1 and level 2 sex offenders, near schools and other places where children are. The DHS has a policy of no more than 25% of a community board's responsibility be single adult men. This would make the responsibility close to 75% of the shelter responsibility here. The community knows that they have to take the first one, which is 200 single men. What are you going to do about the second and third one, which are 200 more and another 140? That the board has a meeting February 3rd on the last shelter, 140 men. But from what we see, these are already done deals. So you're going to inundate this community, Community Board 11, with 540, the predecessor was, with 540 single adult men when the responsibility is about 780 for the homeless, which were families, because this is a community with homes, not single adult people. What are you going to do to stop that?
You know, I've been doing press conferences for many years, and that was one of the longest questions I've ever heard from a reporter. just want to share that. Okay, just want to share that. So let me do this. First, I lived on the verge of homelessness as a child. I know what it is not to have a home. I know that. And I also know what it is to oversaturate certain communities with shelters. And there's something else that I know. I know one of the most challenging population to shelter are black and brown men. No one wants them. We'll take children and families. We'll take single adult women. We'll take any group. But as soon as it's mentioned black and brown men, people say, we don't want them here. And we need to acknowledge that. But we also need to acknowledge that many communities have not had their share of shelters. I'm going to look at this particular issue, find out what's happening. I'm going to communicate with DHS and see exactly what's taking place here. I don't want to overburden certain communities with shelters. Homelessness is a New York problem, and we can't have any sacred cows where some communities believe they're not going to shoulder the burden. That is not going to happen. We all have to shoulder the burden of our fellow New Yorkers. Because that homeless person, that is someone's son, daughter, family member, and they need to support. Now, I would love for my shelters to be in communities that are stable so that they can have access to transportation, access to medical health, access to employment, access to good, healthy food. We can't overburden communities. We need to make sure that we have homeless shelters throughout this entire city, but we also want to cycle out of congregate shelters. We want to move in another direction. But I cannot say it enough, we need help to get this done right. Thank you very much, everyone.